Thank you, Mr. Chairman, and it's a pleasure to serve under your chairship. And I want to thank the Honourable Member for Brent West for bringing this important debate on the urgency and duty of policymakers to tackle air pollution, the silent killer in our towns and cities. I also want to thank all the members here who contributed so passionately and movingly to the debate. Toxic, poisonous air threatens the community spaces that we all love and the people we care most about. It knows no boundaries, reaching workplaces, our homes, schools, and other public spaces. As other honourable members have done, I would like also to pay tribute to Rosamund Adoo-Kissi-Debrah, mum to Ella Roberta. For over a decade, Rosamund has campaigned tirelessly for cleaner air through Ella's law. I had the privilege to meet Rosamund last month when, as a member of the Environmental Audit Committee, we visited communities to understand the physical and mental health impacts of air pollution on their lives. Ella was a happy, playful and bright child. She lived not far from the South Circular Road in Lewisham with her family. By the age of 7, she was suffering debilitating asthma attacks, which would see her cough and wheeze so much that she would fall unconscious. A few weeks after her 9th birthday, Ella died. She has suffered a fatal asthma attack. A landmark inquest in 2020 ruled that toxic air from traffic emissions contributed to her death, marking the first time air pollution was officially recognized as cause of death in the UK. But Ella's death was preventable. Ella Laws proposes, among other measures, to enshrine a legal rights to breathe clean air, requiring the government to meet stricter air quality standards based on World Health Organization guidelines. We must not let children like Ella and their families down as we turn our attention to this urgent problem. And yet, it is estimated that 500 people per week are dying of air pollution-related disease each week in the UK. Air pollution is an invisible enemy and an insidious one. According to a recent report from the Royal College of Physicians, it was linked to 30,000 deaths. And as we heard, it costs our economy over £27 billion per year. Long-term exposure to emissions can cause heart and lung problems, as well as an increase of the risk of cancers. Fine particulate matter from polluted air penetrates deep into the body, setting in our lungs. And recent research has also pointed to the increased risk of cognitive decline, Alzheimer's disease, and dementia through long-term exposure to fine particulate air pollution, which can affect the heart and blood vessels. And this public health burden is not equally shared. The most vulnerable in our society, the elderly, those already facing deprivation, babies and children are most at risk. And the Royal College of Obstetricians and Gynecologists stated that there is a growing evidence base linking maternal exposure to air pollution and adverse pregnancy outcomes. That is why the Liberal Democrats have also called for a new Clean Air Act, based on World Health Organization guidelines and enforced by a dedicated air quality agency. The scale of the issues is such that we need strong, independent oversight that tackles pollution at its source and protects public health. We must also transform how people travel, reducing dependence on cars that spew noxious fumes into the air we breathe. Government must work with local authorities to curb transport emissions. We need to invest in affordable, reliable public transport, ensuring fares do not rise above inflation, restoring the £2 bus fare cap, and improving the passenger experience so that it's cheaper and better travelling by public transport. We must electrify our railways and embrace cleaner technologies and support active travel by creating safe cycling and walking networks across the country. And for those who have no option but to rely on cars, especially in rural isolated areas, we must make the transition to electric vehicles easier and most affordable by expanding charging infrastructure and reducing costs. Finally, we must address the inequalities at the heart of all of this. By increasing the public health grant and empowering local communities, we can develop targeted solutions like healthier and better insulated housing, reduce traffic exposure, or improve local planning. And as some of the members here have also stated, health experts are also recommending stronger controls on household wood burning and effective action to raise awareness of health harms from indoor air pollution, including damp and mould. Children in the UK today have some of the worst asthma outcomes in the developed world. And it is not right that so many lives are shortened by diseases which we can work together to prevent. But most of all, there isn't an effective advice to help avoid air pollution. If that is the only route to work or school, if you live near a busy road, if your care home or schools are sited near air pollutant sources, if your house is poorly insulated. So we call on the government to recognize in law the human right to breathe clean air and legally enforce air quality standards that meet WHO limits by 2030. We owe clean air to the baby born today, to the child coming out of school right now, and every child after them. Thank you.